Good time of the day. Our question today is what's the problem with inflammation and how we can deal with it. At the first look, inflammation seems to be a natural response of the body. So why we should be afraid of it?
Hello, since I became a patient of Dr. Maglion, my life has changed for the much better. Before, no one had an answer for my chronic back pain, but now I'm able to live my life fully, knowing that I'm in comfort and less pain.
Hi, my name is Rochelle, and I've been a patient of Dr. Margolin since 2016, and he is a godsend. The injections that I receive help a lot with my pain, along with medication and other tests that are ran on me, and I would truly recommend him to anyone who's having any type of pain or
I'm an Army veteran, multiple combat tours, and throughout my career, I came home with some bumps and bruises that I struggled to find relief for. My lower back being one of the major ones. After my last visit, and the doctor hooked me up with some shots in my lower back, and instantly, within 24 hours, my back hadn't felt that good since before I joined the Army.
Well, thank you for this question. That's a good point. Inflammation really is a natural response of the body. However, inflammation is divided in something what we call acute. For example, if there is an injury or infection, there is acute inflammatory response that was initially described more around 2,000 years ago. And in Latin, it's called dolor, rubor, those names were learned by physicians for centuries. There is pain, there is swelling, tumor, they called, I think, swelling, redness, rubor. And recently, in the 19th century, they also noticed functionalisia, less reduction of function. In the 20th century, we discovered that inflammation is related to certain substances in the body. I'll just drop some names so you can Google it or read about them. Arachidonic acid, prostaglandins. There is something called TNF factor, which is very important in autoimmune disease, in some other inflammatory processes. And the acute inflammation that is self-limited is really, in a sense, if we can say it, a natural response. However, the problem is when inflammation becomes chronic. When there is no acute injury, but this inflammatory cascade, the inflammatory mechanism is going on. And as we mentioned, pain is one of the features of inflammation. Why is it so important for patients in pain? Over the years, I looked at many MRI scans or x-rays or read reports. At some point of time, I was even trained to read basic spine MRIs. And I noticed that people may have the same injury, more or less the same MRI, CAT scan, or X-ray, but one person can be almost or completely pain-free, and the other person is in severe pain. And I'm talking about sincere people who seem to be really in severe pain. And one of the reasons is inflammation. If you have the same degree of chronic injury, chronic pathology, but one person has a lot of inflammation, again, I'm using lay terms, and the other less, the person with more inflammation will have more pain, in simple terms. Inflammation became very popular topic. I'll just show you, there's a Harvard School of Medicine brochure, Fighting Inflammation. There are a lot of articles and a lot of sophisticated methods and articles that we will not be able to cover today. But the basic idea is that inflammation not only responsible for increase in pain. It may be related to autoimmune diseases. I'll drop some like rheumatoid arthritis, inflammatory bowel disease, lupus, different types of cancer, and possibly or even probably to heart disease, to heart attacks, to atherosclerosis. Cholesterol is still important, but inflammation might be the first step. So that's why that's the problem with inflammation. Chronic inflammation is a problem. The question is, what can you do about this problem? That's the second part of this question. And there are definitely certain things you can modify and certain things you cannot. When I was in medical school, people were taught that we come with certain genes and we should make the best living with them, which is true to some extent. However, today we know that there is more than one gene. There's a bunch of genes responsible for a single trait. And certain good, let's call it good and bad genes, can be turned on and off. And what turns genes on and off, among other factors, different types of foods. So certain junk inflammatory foods also can turn on bad genes. It's called epigenetics. And one of the factors you can modify is what you eat. And there are several methods. I'm not pretending to present the best or the only method, but in context of pain, it seems that avoiding sugar, dairy, red meat, and eating 70%, 80% plant-based food is the simplest and effective anti-inflammatory diet or positive eating. There is also debate on different supplements. My favorite is turmeric, about 2 grams a day. Another one, again, there was a study, for example, in 2014, comparing common supplements of spices, not all of them, but a few of them, and ginger and turmeric came on the top among most commonly used. So you can use ginger, again, better to take in capsules. There are other supplements. For example, moringa has anti-inflammatory properties. There are much more. There are a lot. What is a common mistake that people concentrate on supplements and forgot eating well? So first, you need to have low inflammatory diet, whether the one I mentioned or the one you choose or recommended by somebody else, and only then using supplements. But in any way you want to do it, decreasing chronic inflammation is a great idea, and I hope we'll all be able to achieve it.